What is a dental implant? A dental implant is a small titanium screw that serves as the replacement for the root portion of a missing natural tooth.
This illustration shows an implant being placed after an extracted tooth. Say the tooth is gone here. This shows a cross-section of the bone where we place this little screw. The middle part is called the abutment. That's made out of titanium. And we tighten that and we go back and put the tooth on. And there you go. It's just like you have your tooth back.
Dental implants can be placed in either the upper or lower jaws. Due to the biocompatible properties of titanium, a dental implant fuses with the bone and becomes a good anchor for the replacement tooth. Dental implants can be used in solutions for replacing single or multiple missing teeth.
One thing that I brought to the practice, and I continue to work on with the practice, is trying to achieve 100% oral health for all of our patients. Dad and I now are looking at trying to take every patient who has missing teeth to have all their teeth back. And the reason that we want to do that is because it restores the smile, restores chewing function, and people can actually be at that level of 100% oral health. Being able to restore missing teeth with implants gets you there. That's really my new mission for Cooper Family Dentistry, is for every single patient that comes in the door, focus on getting them to that level to where everything is 100% of their oral health with their hard and soft tissues, their gums, their teeth, and the bone.
Dr. Cooper uses only the best implants on the market. Since 2006, his predominant choice of implant is designed in Sweden by Nobel Biocare. And in his hand, the success rate is phenomenal.
Everybody in America wants immediate gratification. You want to pull through McDonald's and get your coffee as fast as possible. I'm geared that way. I love being able to help people in a very quick fashion. I love being able to see my results in a short amount of time. And I think your patients also appreciate that. They appreciate that they can come in with no teeth, with bad fitting dentures, not being able to chew their food, and within a few months we have them restored to 100% in chewing function. We have a lot of scenarios now with the implant cases where you can walk in with a bad smile, hurting teeth, ill-fitting dentures, painful prosthesis, and I can turn that around within a day. And in one day I can have you feeling a lot better and smiling.
It was easy to put the implant in my mouth. It was painless and it was fast.
I've just been pleased with mine. I have too.
If you're apprehensive about it, don't be. You'll be so pleased with the outcome.
I had multiple implants. I had 2 teeth that fell out in the front. And because of the 2 that fell out, to have implants put in, we had to take 2 more out to have something strong enough to hold all of them. So I had 4 in the front, and then I had 2 uppers on each side and 1 bottom on each side of my chew teeth, because all my back teeth were gone. It's just been amazing that you know, the things that you miss of chewing gum or you know, eating peanuts, or you know, it's just, you know, I went so long with not being able to do them kind of things. I can chew and eat and smile.
Right, I had an implant on the right upper side, and that's a careful implant you have to do because it connects to the sinus cavity, and so it was really important to me that we had someone who was able to do everything they needed to do without invading spaces they didn't need to get into. So the implant process was really easy. It's easier than you might think because there's less involved than you would imagine with the word implant. So the process was pretty simple. We just went through all of the steps in a timely manner, and then the finished product really feels just like one of my teeth that's been there a long time. In fact, it'll last a lot longer perhaps than some of my other teeth. The process really isn't painful at all. There are steps that you go through. Like any procedure, there are things that you're aware of during the procedure, but no pain. Really comfortable overall.
They told me how much it was going to be. They told me how I can pay it off, and they gave me results, and I love my results.
It wasn't, I don't know how long it took, but just a few months, and I have got 2 brand new teeth back there where I had 2 giant gaps, and I couldn't even chew back there. Everything I had to chew was up front. Had them for 6 or 8 years now, and no issues at all. I don't even know they're back there. So I'm real proud to have the implants. I'm glad I did that versus the bridges.
One question I often get is it better to have an implant or better to have a bridge? What I've found is with patients that have healthy teeth and they're missing, say, 1 or 2 teeth, we can put a couple of implants in there without having to drill or be invasive about working on the adjacent teeth. So we're basically just working in the space to put 2 teeth back. So it's a lot more like having your natural teeth. With a bridge, you actually have to cut down the adjacent teeth next to the space. So it's actually a more invasive procedure. In the past, we didn't have the option of doing implants, so a bridge was a standard procedure if you lost 1 tooth. You basically bridged 3 teeth together. In this case, you can't floss in between there. You have to clean underneath that bridge, and it's still an acceptable procedure. However, doing an implant is much more conservative because you don't have to touch the adjacent teeth. If you think dental implants might be right for you, today is the day to get started. Come in for a consultation. Today is the best moment in history for dental implants. They're easier and more affordable, and we have payment options, so there should be no barriers here to care. The decision you make now can impact your quality of life forever. So come in for a consultation and we'll tell you how to get started.